All right, so from a psychological perspective, what if I were to tell you that you actually begin development when your parents are in your grandma's wombs? So when your grandmas were pregnant with your mom and your dad. What are your impressions of that? Like, wait, what? Excuse me? Please explain. Please explain. Okay, Francesca's like, I can see how it could make sense. Yeah, like if I really stop to think about it, I guess it could make sense. Aren't females born with all their eggs, says Ivory, and that is a big clue to it. That is a big clue to it. So just give me a second. Let me let in some people to class so that they can learn too. So yes, females are born with all of their eggs. So that's part of the story. Males are not born with sperm per se. They are born with like, I would say like they were born with the sperm making factory. But they don't actually start really making meaningful sperm until they hit puberty, right? And yeah, the eggs don't have lives in it yet. Okay, but that doesn't mean that they're entirely idle or meaningless. So let's walk through this and let's talk about how we know about this. All right, so we know about this, or rather our first look at this was during World War II. So during World War II, there was a country in Europe that largely wanted to remain neutral. They did not want to have a part of the war. That country was the Netherlands, right? They're like, thanks, no thanks, world. We're good over here. We like our peace. We don't want to get involved. No war for us. Pass. But the Germans weren't really happy with that. They were like, well, Netherlands, you know, you're so close to us and you're kind of like making problems over there. And we need you so that we can get closer to like the UK. So even though the UK, you know, there's water, but it's a strategic location to hold the Netherlands. So what did the Germans do? They blockaded the Netherlands. They're like, okay, we're not letting any supplies come in or out of this country. We are basically going to starve you out until you join us or until you surrender and let us take over you, whichever, right? But we are determined to take the Netherlands. Now, what do you think tends to happen if there is no food present in a country? What tends to happen to people?
People start to die.
Yeah, they start to die from what specifically?
Starvation.
Starvation, right? They're starving now. They're super hungry. So even if they don't die, they are starving people. Well, psychologists were particularly interested in this because this is now a unique moment in time where we can gather data or we can make observations about people. And so although, you know, the nice thing to do would have been to, you know, send aid or something. And I'm sure there were people sending aid. But psychologists were like, yeah, cool. We want to know how this is going to affect people. We want to know how this is going to traumatize them. We want to know how this is going to alter them. And specifically, it would be very, very cool to know about how this is going to affect pregnant people. No worries, Sonia. Glad to have you here. So the psychologists tracked and followed around pregnant women to see what would happen to them in their pregnancies, to see what would happen and to see what would happen to their children if they made it to, you know, if they survived and if, you know, they made it to giving birth to those children. So of the women who survived, right, their children were born relatively unscathed. So relatively typical, which is interesting. So our first thing to learn here, which we knew about before, but we hadn't really seen illustrated in such a profound way, was that babies, when they're in the womb, are like little parasites. And I say that in like the best way. I mean that in the best way. It's a beautiful thing. When babies are in the womb, they are taking from their host, which is the mom, right? They're taking from the host the best possible things. So all the best nutrients, all the best minerals, all the best food, they're taking that and they're going to use it for their development. So when a baby comes out relatively typical after a mother had been starving for a period of time, that's a pretty remarkable thing, right? It's not like they were underweight or that they had any developmental delays, right? No worries. So where was I going with this? I was going somewhere with this. All right, so yes, babies were born pretty typical. But then something interesting happened that later they psychologists decided to remain following these babies just to see how life would turn out like, because there's still stuff to learn, not just developmentally, but stuff to learn about how a trauma like that could affect a person long term. So the psychologists followed these people throughout their lifetime just to check in with them every few years. And psychologically and emotionally, they were like any other random citizen. So of course, some of them had their ups, some of them had their downs. But what was interesting was that the majority of them, somewhere like 93% of them, and don't quote me on the exact number, okay, somewhere around there, in their teenage years or in their like early adulthood would develop diabetes. So let's think about that for a moment, right? Does anybody know how diabetes works? Or so I should say they develop type 2 diabetes, if that makes a difference to you guys. So anybody familiar? Anyone want to share? Or I could keep going. I just
Like
want to see.
your blood sugar is like too high.
Uh-huh. Yeah, your blood sugar is too high. Okay, so when your blood sugar is too high, as a result of that, you have an increase of insulin to try to keep up with that, to mitigate that. But over time, if your sugar is always too high, eventually you'll become resistant to that insulin, and that's what becomes type 2 diabetes. Type 2 diabetes just means you're not born with it, you develop it over time due to environmental factors. Okay. So there you go. Like Aisha said, insulin is no longer a key for the blood sugar to get into the cell. So this was an interesting kind of strange coincidence that the majority of these children developed diabetes later in their life. And when they went back to the mothers and the family history, there typically was not a family history of diabetes, which made this all the more an interesting coincidence, right? Like, I don't know, all these people who were, came from starving mothers, they developed diabetes later. So that's the first interesting point. But then to make matters even more interesting, if those kids had kids, their kids were 114% more likely to be born with type 1 diabetes. So what's going on there? Anybody want to take a stab at it? Tony says my nephew has type 1. He is the first in the family.
Guessing it has something to do with adaptation.
Okay.
Like the mother was starving, she had low blood sugar.
Mm.
So the kid, this is just a theory, hypothetically speaking.
Mm-hmm.
So the kids kind of like mother had low blood sugar the whole time because she was starving, has no food. So the body responds where the blood sugar maybe might have been higher to kind of avoid that, thinking it would be in a similar situation. And when they have kids, it just leads on.
That's perfect. Actually, you hit it right there, Hassan. That's exactly right. Right. So it starts from the grandmother, right? From the starving grandmother who has low blood sugar. So the baby, who's the leech, right, quickly learns through adaptation, okay, food seems to be scarce. Like I'm not getting the nutrients I'm usually getting or I'm supposed to be getting. So I need to store more. store more than I'm used to. And this turned into an adaptation, like a pattern in life. So much so that later in life, right, let's say they had raised they raised their threshold for what they could tolerate sugar and insulin wise. So later in life, it was easier for them to trigger diabetes. And then that adaptation became a genetic trait that they then passed down to their children.
Not to interrupt, but I also read something about this, like with example, like weightlifting, that if you weightlift for majority of your life, and let's just say your spouse, whoever you're with, also does that, that your kids will just be that much more genetically superior because of the fact that you were constantly exercising, constantly lifting. And some people say you can't really change your DNA or genetics by lifting, but like it's proven, like if you're both parents are, going through hard exercise, that the kid is going to eventually think that they're going to have to do the same thing, and they might be more muscular, have more endurance, or whatever it may be early on compared to other kids.
Yeah, no, you're absolutely right. So this is the concept we're talking about, and the concept that Hassan just described in his example is this concept called epigenetics. So epigenetics is this idea that your environment and the stressors in your environment, whether positive or negative, have a direct consequence and impact on your genetics. So yes, there is evidence that we do have the power to change our genetics. It's not like we used to think. We thought, oh, you're just kind of doomed by your genetics. But it turns out that we, in many ways, we are the architects of our lives, right? So genetics, if you think of it as like an architectural blueprint that says, this is how you build a house, right? We are the architects that like look at the blueprint and say, yeah, I mean, that looks good, but I want, a second bathroom over here, right? Like, so you have the power, and it's easier said than done, okay? But you do have the power to change your DNA. If you're interested in looking more into that work, there is a biologist who's made it his entire life work to look into this idea. His name is Bruce Lipton. He is still presently alive, and he's done some fascinating research in this area to kind of see how far he can go with it. So like one experiment he did was he took a bunch of skin cells. So he just like scraped off some skin cells, and he put, he divided it in like, let's say 10 Petri dishes. I don't remember the exact number of how many Petri dishes, but he just had multiple Petri dishes of skin cells. And then he put the cells under different stress conditions. And through different stress conditions and through different environments, those skin cells transformed into other types of cells. Like he was able to make some of the skin cells into like liver tissue cell, and some cells turned into like heart cells, just depending on what kind of environment they were in, which is like totally nuts. All right. So if, like I said, if you're interested in that type of work, please look into Bruce Lipton. But bringing it back into how this relates to class, what we really take away from this is that whatever happens to a woman while she is pregnant can have implications for up to at least 2 generations, if not more, afterwards. So all the more reason to try to take care of the pregnant population, because this is literally the future. I'll start you off with the thing that I actually find the most interesting prenatally is that after those first clump of cells divide enough to then form the fetus, so, that's when you're like a human because you've got a heartbeat, that that first nerve cell that's created through that division of cells is the nerve cell that then stretches out to become your gut and your brain at the same time. Like simultaneously, that one nerve cell stretches. And that cell exists all the way like forever. Like even now as an adult, you still have that one nerve cell that's stretched from your brain to your gut. It is called the vagus nerve, and it is a two-way nerve in which messages from the brain interact with the gut and vice versa. So we now understand that many of the neurotransmitter chemicals are actually created in your gut through what you eat, through the interaction of what you eat with your gut bacteria. Neurotransmitters are made and then sent through that vagus nerve into your brain. So I mean, that's kind of cool, right? Like I find that kind of cool. And so from there, the rest of you starts to develop like pretty rapidly. And by like the second trimester, most of your body systems are there. They're just not like fully formed or fully functional. So the second and third trimester is all about making those systems and those organs functional. Like skin takes a long time for some reason to make. So skin is a process that takes a while. The breathing mechanisms of the lung take a while to, you know, okay, sex. Like if, you know, if you're going to be born with male genitalia or female genitalia, that doesn't happen right away. What happens rather is that you're kind of at the first stages, you kind of have both genitalia. So you kind of have like a little penis and you have like a little vagina, like at the same time. It's just that based on that code, based on like that blueprint that you receive from both your mom and your dad, but mostly from your dad. So your dad's the one who's got that Y chromosome that's going to have that blueprint for which sex organ you're going to develop. Once the development reads through that like code, if you will, it will then preference either male genitalia or female genitalia. And so from there, one kind of becomes smaller and one becomes bigger. So I mean, that's kind of neat. I mean, I find that neat that when we are first made, we are both male and female at the same time. So in a way, we're all transgender. So what I'm going to do is I'm going to show you what that looks like. So just give me a moment to impregnate my balloon. You couldn't find a ping pong ball. It's like surprisingly hard to find ping pong balls. I had to go to like 3 Walmarts. Hey, if you can get a golf ball inside your balloon, I will give you all the praise, because getting a ping pong inside of here is pretty difficult. Like stuck, my fingers like stuck. There we go. All right, so I have now impregnated my balloon. So when you first get pregnant, it is definitely not as big as a ping pong ball. So a fertilized egg that implants is like the size of like a sesame seed, probably even smaller than a sesame seed. It's like really, really itty bitty bitty, those first cells. But we're just going to pretend that this is implantation. Okay. I'm going to go ahead. I'm going to skip. No, I'm not going to skip. Let's talk about first trimester. Let's talk about first trimester. And I try to give you guys like practical life knowledge. Because I want to help you guys like use this stuff in your real life. So practical life knowledge. Once implantation occurs within about the first week, so within 7 days, as the cells keep dividing, the body's going to like completely surge up your different hormones like progesterone, estrogen's going to change, testosterone's going to change, like all these hormones will surge, but especially progesterone, to begin to support the life of creating a human. With that surge comes a change in a woman. So one of the changes that occurs is you become completely sensitive to your surroundings. And when I say sensitive to your surroundings, I mean in almost every single possible way. So you're going to become emotionally sensitive. Like One time I was watching a car commercial with my brother and I started crying, and I was like uncontrollably crying. And he was like, what is happening? Like, my brother was freaking out. He's like, what is going on with you? I was like, I don't know. I don't know why I'm crying. I really don't know why I'm crying, but it was like a really ugly kind of cry. So that's one way you become sensitive. Another way you'll become sensitive is your sensory system will become sensitive. So you're going to hear things a little better. You're going to see things a little better. And the worst of all is you're going to smell things a little better. And the reason why that's the worst of all is because there's another side effect of all of these hormones, this hormonal change, and that side effect is called morning sickness. Now, morning sickness is a bit of a misnomer because in reality, it's kind of an all-day sickness. So all day long, you're going to feel a little bit queasy or a little bit nauseous. And ironically, the solution to that is to eat. However, there are a lot of things that kind of get in the way of that process. One is the nausea itself, and two is that sensitivity to smell. So, you know, pizza smells nice until it smells like 50 slices of pizza shoved up one nostril. Now it doesn't smell so nice anymore. You know, steak smells nice until, again, it's like you have an entire cow shoved up your nose. All right. All of these making it extra difficult to eat. So the kind of tip for that is to kind of find a food, and it could be anything. Okay. Find a food that your brain doesn't gag at the thought of. Okay, so right now it's not about being healthy. Right now it's about what can I put into my system to reduce this feeling. For me, if you're really curious, it was Tostitos. And I never eat Tostitos. I don't actually like Tostitos. I don't like Tostitos. But at the time, that was like the only thing my brain would accept as food. So Beryl, you had a question.
Like my cousin's wife is pregnant, right?
Yeah.
She told me that she's like, I want to eat something. Like, she know when she's there, she's like, she wants to eat something, but she doesn't know what she wants to eat.
Yeah.
But then she would tell me how it smells, and I'm like, what? And she also told me she ate something she didn't like, but then
Yeah.
she started liking spicy food, even though she doesn't like spicy food.
Yeah. It's
I
so
don't understand.
interesting.
I'm just like, what are you talking about? She's like, you
Yeah.
get there when you get there.
You'll know when you know. But it's true, right? And the idea is, although there's no easy way to measure this for sure, but the theory is that whatever it is that you're craving or that you're like okay with eating is what your body actually needs. There's something in that Tostitos, whatever that is, that your body needs, right? There's something in that spicy food that your body needs to support that baby, right? And it will change. Like after the first trimester for me, I didn't crave Tostitos anymore, but I craved vegetables, a lot of vegetables. And I don't really like vegetables that much, but I was like, I need to eat all the vegetables. And I'm guessing it's because vegetables are not usually a huge part of my diet, but it was necessary to support my child and her growth. Zahra said something similar happened with my mom during her pregnancy with my little brother. The only thing she ate was hot dogs. Yeah, it's like, what? Maybe there's some nitrates or some like sodium needs that your mom needed. My mom sent my dad out to get a watermelon at 2 a.m. And sometimes it's a one and done craving. I remember one time I very specifically needed Subway chocolate chip cookies. I could not accept any other chocolate chip cookie. It had to be from Subway. And of course, it was just my husband's bad luck that day, all the Subways he went to were out of chocolate chip cookies. So it's just like, the reason why it's called morning sickness is because most women will experience the strongest part of their nausea in the morning because you didn't eat all night long. So if you're waking up on an empty stomach, you're going to feel very nauseous. So kind of pro tip is to have a food that your brain finds acceptable on the nightstand. So like if you happen to wake up in the middle of the night to pee, which you probably are going to wake up in the middle of the night to pee, then, you know, take a little nibble of the snack and go back to sleep. It will make it less, or at least when you first wake up, grab that snack and it will reduce that. Now, the good news is that for most women after that first trimester, when everything, like when your body's like busy at creating all the organs, things kind of slow down a bit, and then the nausea is eliminated for most women. If you find yourself still nauseous in the second trimester, you need to talk to the doctor to find some pregnancy safe nausea medication. I think there are some out there, but usually doctors try to shy away from medicating because there's always a chance and a risk that the medication can affect the baby. Okay, so now I'm going to skip to the third trimester. So is there any way where if you eat a certain allergen while pregnant, the baby can build an allergy to it? Because my mom really only ate peanut butter. She was pregnant with my sister. My sister's highly allergic, but she didn't have any while she was pregnant with me, and I didn't get the allergy. To be honest, Jessica, I'm not sure about that one. I'd have to look that up. So during the break, I'll look it up. I will look it up and see. But I haven't heard about that. All right, so if you followed along, like if you're doing this at home, and you got your ping pong inside the balloon, I would, you know, just blow up your balloon. And then what's interesting, and for those of you who can't feel a balloon because you don't have one, just kind of try to imagine, and maybe you can kind of see it when let me see. Okay, do you see that movement right there? So you kind of have to imagine like my hand here and the ping pong moving. Like I can really feel that. I can really feel the ping pong, right? And so that's what it feels like when a baby is inside the womb moving. Like you really feel every single moment of that movement. Movement begins around 18 weeks for a first pregnancy, and the second pregnancy, it starts a little, you can feel it a little sooner. But then as you get to the third trimester, so it's not a one-to-one, okay? In the third trimester, you just got to imagine this ping pong ball is pretty much as big as this balloon, or, is equivalent to the size of the balloon. And so what's interesting is that becomes like a tight space. So babies are kind of like scrunched up in the fetal position. Oh, pardon me. I told you she was going to come back. I know my child. There you go. Yay. Don't forget to close the door, please. Thank you. So with such a tight space, and if you kind of are the same size, right, you have to also imagine that at some point, you're going to start not just feeling the baby, you're going to actually start seeing the baby. So see how like you can actually see the ping pong? What was, oh, okay, that was that mistake. So for example, like if the baby puts their hand like on the womb, like you can see the hand and the element. It's a little freaky, I'm not gonna lie. It's a little freaky because you're like, oh wow, that's like a human. I mean, it is a human. You're like, I remember one time I was changing and I saw my daughter's butt, like she was pushing her butt into the womb. I was like, oh, that is a butt. That is a butt cheek. Like, okay, that's cool. So I don't know, just telling you so that you're prepared of what to see, so you're not freaked out first. If it's not settling head first, so that's how you prepare for the exit. You exit head first. If it is not head first, then your practitioner will work with you to rotate the baby. And there are different ways to rotate the baby. Some people, dance, some people just walk. Sometimes you can just kind of like push the baby gently, like a massage, like getting a prenatal massage can help. getting a chiropractic adjustment sometimes does the trick. If for some reason the baby won't rotate and won't turn, you are now at risk for a C-section because you cannot birth the baby feet first. Antonia says, I heard that it is painful when the doctor steps in to do it, or it's a C-section. There are definitely ways that are not painful, right? Of course, if it's going to become kind of forceful, it could be painful, especially if they're going to stick their hand up to try to help to rotate. That's a whole hand and arm, like all up in you. That's going to hurt. I heard having to push to rotate the baby hurts really bad sometimes too. Yes, it could. The good news is it's on the rarer side, so that's not the norm. So I don't want you guys to like get all like concerned that this would be something that could happen to you or someone you know. It happens to way less women than you would think. My mom had my sister naturally and me through C-section, and she says C-section was the easiest thing on her life. Yes, yeah, I mean, there are definitely pros and cons. There are pros and cons. C-section is easier as far as birthing and stuff goes. Recovery, not so great. Recovery wise. Okay. But okay, let's talk about what happens now when it's time to go. Let's say your baby is rotated face down, everything's ready to go. Sometimes women will start to feel contractions, and they'll feel contractions kind of on the side of their uterus. Now, the baby is so large and your uterus is so large at this point that you won't be able to localize. Like, you're not going to be able to be like, oh, I feel contractions in the middle. Yes. Okay, you want a balloon? Let me give you a balloon. Yeah. Okay. Perfect. Sorry, guys.
Can I make one the same as yours?
This is the only time I'm going to be able to do this for you. If you need help, you need to go find daddy, okay?
Okay.
Is that okay with you? I need to finish teaching my class. All right, thank you. Here you go.
Is that how big yours is?
Is that how big yours is? I'll make it as big as mine. There you go. Hold it tight. Hold it tight. There you go. All right.
Oh, no.
You gotta hold it tight. All right.
Tell Daddy.
Yeah, go tell daddy, even better. Bye. We should have her on the show, right? We should have her on next week when we talk about like toddlerhood, or the week after when we talk about preschoolers, because she's a preschooler. We should have her on. Don't you guys think we can interview her for class?
She can tell us
Yeah.
her experience.
Yeah, tell us about your life. Why not? It'll be fun, right? Like, here's a live preschooler. Let's ask how they see. Like, it can actually be pretty entertaining. So you know what? We're gonna do that. We will do that. But now back to birth. So you're not going to be able to localize where your contractions are. So a lot of women will feel like contractions, and they're going to like call their doctor or rush to the hospital, be like, oh my gosh, it's time to give birth. But notice when I make a contraction here that there's really nothing going on, right? Besides the like squeeze, like there's nothing happening to the baby. Like it hasn't made any kind of attempt at exit. It's just a contraction, feeling of a contraction. And those are called Braxton Hicks contractions. I don't call them, like, just for the sake of our class and remembering, you can kind of call them false alarm contractions. They don't really do anything. All right. So now my other question then is, who or what does the birthing? Who or what births the baby? doctor, the uterus, the mother.
Like, who helps a mom give birth?
I'm asking what mechanism or who or what makes this baby come out? The
When the
cervix,
water breaks.
the water breaking. See, this is why pushing. Okay.
Isn't there a hormone, oxytocin, that once the baby pushes on the cervix, that's when your body like knows, and your hormone of oxytocin goes up, and that's what starts opening the cervix?
Yes, ding, 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 ding. Hooray, we've got a winner. So technically speak, like if we're being like really annoyingly technical, okay, and this is like annoying technical, it is the brain that then the brain begins the birthing process by signaling the uterus to contract. A lot of people say it's the mother, a lot of people say it's the pushing, but women can be in a coma and still give birth. There's no telling a pregnant woman in a coma to push, right? You can't be like, push, push. She's gone, like she's not consciously available. Yeah, mind bomb, right? Like I remember when I first learned that, I was like, oh my gosh, like I don't even have to be there. This is gonna be amazing. You don't even have, you just have to like, your body has to be present, and that's all you've got to do. You don't have to push. You don't have to like, there's not like, you just have to show up. Your body does everything for you. So yes, it starts with oxytocin. So oxytocin, usually nicknamed our love hormone, but in this case, it's going to bring the love of your child to your world. And it does that by signaling the uterus to contract. Now, what's interesting about oxytocin is that it's what we call two-pronged. So the first prong is the part that signals the contraction, and the second prong is the part that signals the anticipation of that bonding and of the love that's about to enter your world. And what's neat about that is that love, or the expectation of love and bonding, kind of counteracts the pain that's going to come from the contractions. So I'm not saying it's a clear wipeout and that you'll have zero pain, but it also acts to reduce a lot of the pain that's going to come with contractions, which is like really cool. It's really, really cool. So here's how actual contractions happen. So the real contractions, the one that's going to burst the baby, happens at the top of the uterus. So before we said, side contractions, Braxton Hicks, false alarm, nothing happening to the baby. Real contractions happen on the top. Okay, you notice now a real physical change. Your uterus is going to change shape, and your baby's going to work its way down. Okay, so let's reset this just so everybody sees again. When the baby is ready to exit, it settles in here at the top. That is what's the cervix. That's what's called the cervix. Okay, the cervix through the contraction is going to slowly kind of bend away to help baby shimmy down into kind of the vaginal tunnel. Okay. So let's see what that looks like. So here's a contraction, changing shape. Here's a contraction, changing shape. During a first birth or first pregnancy, you're going to be going through this kind of contraction on and off for about like 20 hours for a first time birth. It can go longer. It can go longer. With me and my dear child, she took 39.5 hours. Yippee for me. Okay. Now the first, let's say 12 plus hours, like for me, it was the first 24 hours, but for normally it's like the first 12 to 16 hours. You're going to be in what's called early, you guys didn't know, now you know. Okay, you're going to be in what's called early labor. So in early labor, what tends to happen is you have a contraction that's like a strong, kind of like, again, for females, you'll know what I'm talking about. Males, you'll just have to guess, but it feels like a really strong period cramp. Okay, so you'll have like a strong period cramp for like 30 seconds, maybe a little more, and then you'll have a break for like 20 minutes. And that's the first 12 hours, 15 hours, in my case, 24 hours. Okay, that's not that bad, right? Like you have a cramp, it's like cramp, and then a 20-minute break. You're like, oh, that's fine. Like I'll go grab a snack, I'll watch a movie or like a TV show. Like it's not so bad. And we'll have a review. I have an image to walk you through, and you'll even see like in the image, like the woman in the image is like smiling, like this is great. Like da, 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 da. In a way, though, it's a little bit of a false hope, because it really makes you feel like I can do this. Like, and you can do this, by the way. Literally, women have been doing this since the beginning of time, right? But it kind of makes you feel like, I don't know what those other women are complaining about. Like, this is the greatest thing I've ever done. Like, I can birth all the time. Like, give me all the babies. Like, this is a piece of cake. But what's actually happening is your body is like getting it's doing a systems check. It's just doing a systems check. Like, okay, contractions, you on? Yes. Okay, keep that kind of moving. We're just warming things up. All right, cervix, you ready? Yeah, ready. So for like 15 hours or so, you're just doing a really annoyingly long systems check. Eventually, when you're in active labor, the contractions will come closer together. So now you're doing this, like this big squeeze, and it is a change, right? It's a change in shape. It's a change, like it is intense. Okay. You'll have now a contraction for about like a minute. And again, it doesn't sound so bad. You're like, okay, I can handle things for a minute. But then you'll only have like a 2-minute break until the next one comes. So 1 minute on, 2 minutes off, 1 minute on, 2 minutes off. And when you talk about it theoretically, 2 minutes seems like a long time. You're like, all right, I've got double the time to rest, right? Like 1 minute of like intensity and 2 minutes to like catch my breath. Like that seems reasonable. But the reality of it is that when you're in it, time moves really weirdly fast. So those 2 minutes when you're in the thick of it really feel like 10 seconds. Maybe on a good one, it feels like 30 seconds, right? So that's the reality of it, is that you just feel like you can't catch a break, right? It's like, ah! Right? And that's where you get women who can just say like one word at a time. You're like, me, water. You're like, okay. And I'm a little bit over exaggerating and a little bit under exaggerating. It's just really hard to fully reenact it. I'm sure I said some weird things. I think at one point I like yelled out my brother's name. I'm like, why am I yelling out my brother's name? I don't know. I just felt like I had aggression in me that I needed to yell out and take out on my brother, right? So I was like, come in, rah! Like, why? No idea. Okay, usually this is the time where women will ask for the epidural or something like it. Like, please give me something to knock me out or to dull the pain. And it's not because it's particularly painful. It's because it's a lot at once, right? So if you want to know what it feels like if you have a TENS machine, or if you go to a gym, most gyms have a TENS machine, right? You could go, and if you don't know what a TENS machine is, I'll show you. This is a TENS machine. Okay, and it has like these little connectors that you can connect like a pad to, or like a gel. Let me see if I got it. Like one of these gel pads, right? And you could just kind of put it, for ladies, you could put it where your uterus is. For guys, you just put it like a little bit like where your a little bit above like where your hip bone is. And you could try it out yourself. Like you could see what it feels like. Anybody can handle contractions when it happens for like 30 seconds. The hardship is when it's happening like for hours and hours with like little to no break in between. So when women ask for an epidural, again, it's not because it's so unbearably painful, it's that this wave is coming at like a nonstop rate where you just can't catch your breath and you like need a break because you've been doing this for like 10 hours. So that active labor that I'm just describing for a first time birth will last you probably around 10 hours. Then after active labor comes transition. Transition means that your body is now transitioning the baby into the birthing canal, which means that the cervix is completely effaced, meaning that the cervix has completely bent upwards so that the baby has no obstruction for the exit. So what that looks like, so I reset this again, right? So early labor, like it's making a little bit of progress, right? And then active labor, right? And look how that baby is just traveling down. Okay, now we have pretty much no cervix. Okay, and it's just kind of like a little bit of a tunnel. And if you look at it, you can actually see the head. I see the head, right? That's called crowning because the head is the crown. So when you see the head, you know that you're probably in transition and birth is coming soon. Now, during transition, the contractions are like a minute or so, and they come like every 30 seconds. It's intense. It's very intense. But once it's over, comes the birth, right? So all of what I've been describing is stage 1 labor. The birth itself is stage 2. So when you see crowning, like when you see the head, that's when the nurse is going to call the whole crew in. So all of a sudden, all the lights come on, the doctor comes in, the doctor's assistant comes in, like 3 nurses comes in, and it is showtime, right? They're like, all right, it's time to push. Now, like we said before, the body does this work. The idea that the woman has to push as well is completely false. If anything, what you should be doing is breathing into it. That's what assists the push, the natural push. If you're actually going to try to put force into it and try to push, what you're going to do is exhaust yourself, add to your pain, and tear yourself up down below in a very bad way. Okay, now it is normal. Most women do tear down there when they birth, but if the harder you push, the more likely you are to tear even worse. So just keep that in mind. When it is time to push and the body is pushing, what's interesting is that from like a intensity perspective, the intensity changes. So it's no longer a contraction or like kind of like feeling like you're getting electrocuted or feeling like a really like the worst period cramp on earth. Now it's so cool. Now it really feels like your body, like your whole body is pushing down to get that baby out. And that pushing process is like 30 seconds of push and then like a 5-minute break. Like it's enough time, like 5 minutes now feels like a legitimate amount of time. So like your body pushes and it's a gradual thing. So before it was like an all-in-once thing. When the body pushes, it's kind of like it's like the opposite of what I'm about to do with my hand. It's like a right. So it's not an all at once. It like starts small and it crescendos. Right. So you can actually feel when the push is about to come. And you're like, all right, here it comes. And it's like push. And then 5-minute break. And you can like wipe the sweat off and you could take like a sip of water. You can make a joke. And then it's time to push again. All right. Now I saw a hand up.
That was me, but you answered it.
I answered it. Okay. So now let's go ahead and do phase 2. We're gonna birth this baby, right? So I'm giving myself some space. So what's gonna happen is the baby at some point is just gonna literally fly out, and it's actually pretty similar to real life. After the head comes out, the rest of the body just kind of like flies out. So somebody needs to be there to like catch the baby. So let's just, actually, before I birth the baby, let me also point out that in our traditional setting, so in America right now, and like our current times, the traditional setting to give birth in is a hospital. And so typically what happens is the woman is on her back or maybe seated at an incline, and then the doctors come and they put her legs up. Okay, now I just want you to think about if this is an ideal position to birth or not. You can think about that on your own. All right, I'm gonna take a more, for this example, we're just gonna pretend the woman is standing straight up. So let's just go ahead and finish this, right? So push, right? Push. And this part is pretty fast relative to the rest of the labor. This part is anywhere from like 5 minutes to like an hour, which at that point, an hour seems like a piece of cake. Come on, baby. Come on, this is where you have a good support network to be like, you can do it. And there you go. You have to have your support, like, don't give up, just breathe into it. And then you birth the baby. And that's stage 2 of labor. Stage 3 of labor is birthing the placenta, because yes, that has to come out too. You cannot leave the placenta inside. Typically it happens right after, like your body just continues pushing and then out flops the placenta. Sometimes they might ask you to give like a little bit of a good breathe, like breathe into it, or like a push, but it's not hard. Sometimes if they're weird about it, they might like rope it out of you. Don't let them do that. It will feel really weird. But after you birth the placenta, congratulations, you are now done with the birthing process. The placenta, by the way, they'll ask you if you want to keep it. Some people do keep it. Some people eat it. Like they freeze it and feed off of it for like a year, which seems very bizarre for a lot of people. Now, theoretically, it's genius. I could never bring myself to do that. But the placenta is, you got to think about this. The placenta is the powerhouse that just supported this human being. It has the best nutrients, the best minerals, most of which it stole from you. So by eating the placenta, you're really just remineralizing and revitalizing your own body of its own nutrients. And the reason why this could be also a good idea is because, for example, like to put it in perspective, it's very common for women after giving birth to develop a ton of cavities. And it's not because they had poor dental hygiene, it's because their baby might have been pulling calcium from them. And some of the easiest places to pull calcium from is the teeth. So if you don't have strong tooth enamel, you're just more prone to developing a cavity, even with the best dental hygiene. So eating the placenta and remineralizing from that might help to, all right, so APGAR checks. All right, so the first A in the APGAR stands for appearance. So the nurse has to check on a scale of 0 to 2. So 0 appearance would mean that the baby, whoa, that scared me. Thunderstorm. A 0 on the appearance scale would mean like the baby just does not look lively, like their skin looks dull, bluish, not alive, right? A 2 would be like, you know, looking tan or looking rosy or looking golden, depending on your skin tone, right? It's just looking fully alive. So that's the first check that they do. The second is the P for pulse. Usually they have a cute little boot that they slip onto the newborn's foot, and that's what's checking the pulse. So 0 would be no pulse, 1 would be weak pulse, 2 would be acceptable pulse. G stands for grimace. So babies are born with certain reflexes that are specific to infants and infants only. So you want to make sure that those reflexes are there because it is a signal that the brain is functioning properly. And one of the easiest reflexes to check for, I don't remember the name of it, but it's on the foot. So if we're pretending this is a baby's foot, you just take your finger and you stroke it from the bottom to the top, and you should see the fingers kind of fan out. I think it's called the Babinski reflex. I could be wrong. But you should see like the fingers fan out, especially the big toes should kind of like really fan out. So that's the grimace check. The other A is for activity or muscle activity. You want to see that they have some kind of muscle tone, that they're kind of moving around. You know, they're like little, you know, like little lizards, right? They're like, not that they're like floppy and unable to like move their arms or legs or kick. That would be a 0 if they're floppy. And then the R stands for respiration. So you want to make sure they're breathing. Now, if a baby is crying, they're breathing. Not all babies come out crying. So if they're not coming out crying, you got to make sure they're breathing through like checking if you can see their chest rising and falling, or, you know, checking under their nose. Or the fastest way is to make them cry. So that's where you see, like in movies, where you smack a baby on the butt, and if they start crying, hooray, they're breathing. So a nurse will do that check at about 2 minutes after birth. And if any of the scale was less than satisfactory, they'll do another check at about that 5-minute mark, because sometimes it takes a few minutes for systems to really get started and acclimated to the world. All right, so that was a lot of information, guys. Right, so I want you guys to start practicing in general. Like if this is something you're going to pursue long term, like if you want to be a psychologist, especially, you have to really understand that data is one thing and then life is something else. Data can inform life, data can inform decisions, data can inform judgment calls. But at the end of the day, life is dynamic, life is unpredictable, life is weird. So there's so many stories of like people defying the odds. And it's because the odds are just averages, and nobody says that you have to be average. Right. So please, please, please keep these things in mind. On that note too, like going back to the birthing process, you have to be able, like if you're the person birthing, you have to be able to trust yourself and trust your body. If you do not, and you just rely entirely on medical professionals, and there's nothing wrong with that. Obviously, they are professionals for a reason. They do this stuff every day. They've seen a lot of things. So I'm not here to like downplay anybody's expertise. At the same time, though, there's only an extent to what they can see and what they can feel, and what, you know what's happening in your body. And an example of that from my real life was when I was giving birth. I knew when my daughter was coming, but the nurse was like, you are not fully dilated. And I'm like, that's cool and all, but I feel my daughter, she is coming. Like it is, the push has happened. Like the birth is happening now. And the nurse was just like in complete like denial. And then she left the room, and I like turned to my husband. I was like, it's happening. And I'm just going to go for it. I'm going to support my body, and this baby is coming. And like 5 minutes later, my daughter was born. It's like, because I just knew it was happening. Like a note on the note is that medical textbooks are written for an average based on one type of person. Typically, it is a Caucasian person. And the thing is that we're not all Caucasian. There's nothing wrong with being Caucasian, just that we're not all Caucasian. And so there's going to be differences in what your body does from into the 4th trimester. So a lot of books don't talk about this. A lot of people don't talk about this, but there is a 4th trimester, meaning so trimesters happen in 3 months. So after birth, 3 months in like postpartum, there's going to be changes, rapid changes, not only in the baby, but also rapid changes with the mom. And part of that rapid change is now that the baby is no longer supported by the host, the mother gets the signal, or rather the brain gets the signal that it's time to go back to homeostasis. It's time to get back to our version of normal. And so just as quickly as that cascade of hormone happened at the beginning, is just as quickly as that cascade of hormone is going to kind of unravel at the end. So that's one thing to keep in mind. Second thing to keep in mind is most women go through 20 plus hours of labor. They are sleep deprived. They are usually hungry because most hospitals do not allow women to eat in labor. So you got to imagine how much energy depletion is. If you're like me, I labored for close to 40 hours. 40 hours without food and without sleep, after pushing out an entire human being from your body, then the cascade of unraveling of hormones, then an infant who does not understand yet that it is a separate being from the mother. These last 9 months in the womb, the baby literally thinks they are one with the mother. So even though the umbilical cord has been cut, there's the psychological umbilical cord where the baby does not yet understand that they are an entirely different being. So they are very demanding and needy in a good way. I mean, they need to survive, they need to attach, but that is very demanding. And babies run on a 90-minute cycle. So every 90 minutes, this baby is going to want something that can most of the time only be given by mom, like, breast milk. Okay, now you can decide not to do breast milk, or you might not yet have, might not be able to produce breast milk. We'll get to that in a moment. And so, you can get people involved to help with baby, but I'm putting it in context, right? So, 20 plus hours of labor, no food, no rest, a baby who needs something from you every 90 minutes, and hormones going wild. So it is no surprise that women will feel very, very depressed at this time. It is, in fact, incredibly normal. It hits about 80% of women. That's how normal it is. 80% of women are going to fall into a depression. Now, it's not going to be postpartum depression. That's different. It's just a mild depression. Within that mild depression, through that lack of sleep, through that lack of nutrition, it is no wonder that you just don't want anything to do with the thing that's the most demanding in your life, which happens to be the baby. And then there's the mom guilt. But I'm supposed to like my baby. I'm supposed to love my baby. I'm supposed to know what to do. I'm supposed to have mother instincts. All of that is a myth. All of that is a myth. A baby is like any other human on earth. You have to learn to love them. It does not necessarily come automatic. How long does the depression typically last? So that is the 3 months. That is the 4th trimester. So you're going to have this blues or depression for about 3 months. It does gradually get better. I'm not saying it's at the same level the whole 3 months. So it starts off bad and then it tapers off through that 3 months. So you progressively get better throughout those 3 months. And typically it subsides after that, and it's not so much of an issue. When it turns into postpartum depression is at that 3 month point. If there's no improvement and if there's the mom feels no hope for improvement, that is then reclassified as postpartum depression, and it needs attention right away, because if you let that unravel and cascade even more, it can become like suicidal. So first-time mothers are most prone for suicidality in postpartum depression. And after middle-aged men, first-time mothers are the highest risk for suicide. So middle-aged men are highest risk, outside of old age, because that's a whole different ballgame. We'll get there eventually in the semester, by the way. So apart from old age, like if you take old people out of this mix, most at risk for suicide is middle-aged men, then it's first-time mothers, and then it's the youth. Okay. What else in this period that we could talk about mothers wise? So I'm not going to get too much into the infants because we'll do that next week. Next week, we're going to do infancy and toddlerhood. Today, I just want to focus on mom in this process. Oh, on top of all of that, some of the things I had left out. So birthing is also a large exchange of liquid. And through that exchange, you might have heard of a concept called osmosis. Maybe once upon a time in biology class, you're like, oh, this kind of sounds familiar, right? Osmosis, when there's less water outside of an organism than inside of an organism, the water leaves, to create balance. So through this transfer of liquid through the birthing process, through the loss of the placenta, the body is going to retain some of that liquid. And that liquid, since we are, upright creatures, that liquid tends to travel down. And so the result is that a woman's legs and feet are going to experience extreme swelling. I'm talking so extreme that it's very common that your feet will not fit into your shoes or your flip-flops or anything. You'll have to like either squeeze it in and tolerate it, or you're just going to have to go barefoot or wear socks or whatever. That typically lasts about 2 weeks. Most women also don't realize that you're probably going to be like wearing a diaper for like a solid month or so, give or take. Everybody's a little different in the healing process, because giving birth is kind of like surgery in the sense that you've like ripped up your organs. So I mentioned before tearing, typically after birth is finished, the doctors will stitch you right up. No anesthesia needed, because the high of giving birth acts like morphine. So you don't feel the pain of them stitching you up, which is cool. But the side effect is you've now got like a wound that needs to be attended to. And there's going to be bleeding from that wound, and you need to like clean the wound, and it's a mess. It's a mess. This is after birth, right? Yeah, the swelling is after birth. To add to the fact, like, why are women so depressed or why they don't like their babies, add to the fact that our country just lacks a support system. You have a teeny bit of a support system in the hospital. So there is this beautiful luxury in the hospital of having a nursery. So you can elect to like send your baby away. You're like, go away to the nursery where the nurses will kind of like attend to it. So that's what you see in the movies. You see like a hall of like little newborn babies. That's the nursery. The idea is it gives mom like a chance to attempt to rest, but that rest gets disrupted because about every 2 hours, a nurse is going to be coming in to check on you, to take your vitals, to see how you're doing, to push on your belly, which, I mean, they're doing their job, but it is also annoying when you've just gone through this marathon and you're trying to rest. And then, of course, they're going to bring your baby anytime it needs to be fed. So then that's an interruption. So it's just like a series of interruptions. And up until that point, as a first-time mom, you're just not used to that kind of interruption. It is an extreme interruption. But at least in the hospital, You feel like somebody's looking out for you, or somebody's like helping you. And the nurses will also help to get breastfeeding going, because people might not realize it's not like you give birth and then breast milk is just abundant. You just have breast milk. It doesn't work that way. Actually, the first week or so, and everybody's different, you don't have breast milk at all. What you have is something called colostrum, which is like this golden thick liquid. And it's not a lot, right? So if you're thinking of like a baby bottle, right? I'll pretend this is a baby bottle, right? Breast milk, you know, if it's abundant, maybe you can like fill like 3/4 of this, right? That would be like breast milk. Colostrum in comparison would be like this much. Like there's not much that comes out, but it's enough for the baby because it's really nutrient dense. It's like packed, right? So it's like almost like 10 times powerful than breast milk. But you need to kind of train your body to produce breast milk. Like I said, it just doesn't come. And the way you train your body is through either breastfeeding or attempting to breastfeed, because as the baby latches onto the nipple and does kind of like that sucking motion, that is then signaling the brain and the glands, the breast glands, like, hey, you need to produce something. Something here needs you. You need to be in production. And so the more you do that, what you're doing is you're signaling to your brain and your body how much it needs to produce. So some women, it's encouraged that you also do pumping. So pumping is like a machine that like latches on to your nipple and your breast and like sucks out. It's basically like milking a cow. Okay. And you will feel like a cow. You will definitely feel like a cow. But that's all for the purpose of making sure that you create enough breast milk to begin with. If you're not creating enough breast milk early, what tends to happen is you will taper off quickly. So a woman has the most breast milk she's going to have at the beginning when she first, like when the baby is a newborn. As the baby grows, the breast milk's going to get less and less, mostly because the baby won't need so much. But sometimes women deplete way faster than they anticipated or that they wanted. And so this is where formula comes in to help supplement that feeding. But there's a lot of emotional stress surrounding formula because people hear like, oh, it's not as great, or it's not good, or it's whatever. But the thing is, at the end of the day, yeah, is it better to have breast milk? Theoretically, sure. Why? Because through the breast milk, as it comes through the mother, you're getting whatever nutrient and immunity that the baby needs through the mother. Like, so if the mother gets the flu and she's breastfeeding, she's sending antibodies as she recovers from her flu to her baby through the breast milk. So it's kind of acts like a natural vaccine, if you will. Formula cannot do that, right? So that's where people freak out. They're like, it's not natural. You're not giving the good stuff to your baby. Like, they're not going to get any antibodies. They're not going to have a good immune system. Sure, but a baby's got to eat. A baby needs to eat. They absolutely must eat. So instead of shaming mothers, we need to support them, right? Encourage them. I know myself, my supply drastically changed at around the 6-month mark. And I had it in my head that I really needed to make it to 1 year. Actually, originally I was like, I'm going to do 2 years because that is the healthiest for baby, which is true, right? But then after my supply started going down, I was like, I need to make it to 1 year. And then I just became obsessed, and it was stressful, and it was frustrating, and it was depressing. And after the 12-month mark, I switched to formula anyways. And then I was like, why did I not do this sooner? I was like, why did I make myself suffer? It was better if I was not stressed, because I'd be in a better state of mind to take care of my child. than to stress over how she eats. Lena, your hand is up.
I'm sorry to interrupt, but
Yeah.
isn't there pills where you can take to generate some milk in your
Mhm.
foods?
There are definitely
Breasts?
things you can do. There are definitely things, and most of them are natural, which is awesome, right? There are things you can do to help your supply, and I tried a lot of those things. So you could take fenugreek, you could take fennel seed, you can take anise seed. But it's not like it's going to make your supply exorbitantly abundant, but it will help, right? They also have like lactation brownies. Like there's a bunch of stuff out there. The lactation brownies taste amazing, by the way. They're really, really yummy. Lactation cookies, all sorts of things. But like I said, it's not going to be like the magic wand that's going to solve all your problems. It'll just kind of like hold you over it. And at the end of the day, maybe that's enough for you. And maybe that works for you. And that's great. At the same time, try, and this is the benefit of taking this class, try not to make it a point of stress, because a stressed out mom will translate to a stressed out kid because they feel you, especially in the very beginning, like the first 4 months or so. They still feel like they are you. You and them are one person. So whatever you feel, they are going to feel. Is the amount of milk someone can produce predetermined? In a way, right? So some of it has to do with that blueprint, with your family history. And so one of the reasons why I struggled was because of my mom's history. Like this is my family's history. We're not huge producers. Like my mom, she was able to feed my sister for 4 months. So my sister came first. I was second child. She got me for 6 months, breastfed, and then my brother also like 4 months, right? So 6 months was like her peak, and then her supply just disappeared. I kind of followed suit. I mean, I only have the one child, so I don't have lots of data, but I'm kind of following suit in the sense of 6 months was the mark at which I dropped off. Like I didn't drop off completely, but my supply took a huge hit. So that tells me that there must be some kind of genetic component. But remember what we talked about with epigenetics and environment. By changing my nutrition, by working on my stress, by taking these supplements, I was able to stretch it out to 12 months. So I doubled my family's history. So keep that in mind as well. With all that said, though, maybe don't do it. I mean, I don't know if that was the best decision because I was super stressed out about it. It was like the worst time ever. And it was the biggest point of pain for me. Like emotional pain to try to like breastfeed. And I also hated it. And I felt like all the moms who said they loved it were liars. I was like, how do you love this? It's like the worst thing ever. More power to you if you love it, by the way. It could be a very beautiful thing. It seems like a very beautiful thing for a lot of mothers. For me, it was just torture. It was absolute torture and I hated it. Yeah, no worries, you guys. I'm trying to keep it real. I'm trying to make it useful. Abby says it's painful. For me, it was painful. It's not painful for everybody. For me, it was painful because I'm just really sensitive. Everyone's different. Everybody's different. Luckily, I never made it to the stage where my daughter had teeth while breastfeeding. I don't want to imagine what that's like, having like somebody with teeth trying to feed from you. I imagine it's not that much fun. But I could be wrong. I don't know.
Yeah. When my mom was breastfeeding me, I think I grew some teeth, and
Yeah.
I think one time when she was, I think I bit her
Yeah.
nipple, and it sent her to the hospital.
Oh no.
I think I got her a fever and infection on her nipple.
Oh
and
no.
terrible. Yeah, I was a
Ouch,
biter.
ouch. Ow, no, ow. Yeah, no. So this is good to bring up. There is a something that there are two things that can happen, or two major things that can happen aside from like your kid biting you. while breastfeeding. If you have milk, and if you are blessed with milk, you need to empty the milk. It needs to go somewhere. If your kid's not available to feed for some reason, because maybe you're at work, which is so terrible that we send mothers to work so quickly, okay, then you need to pump that milk out. If you do not, and if you let the milk build up, because remember, your brain has now created a schedule of expectation of when your child feeds, like a pattern of expectation. So your breast is going to fill with milk because it expects your child to feed. If it doesn't feed, it just sits there. But then when the next feeding comes, it's going to fill. So what happens is your breast is going to overfill, and you can literally see this, like your breast is going to be like as big as your face. And then you can get an infection called mastitis. So mastitis is when your milk ducts become clogged because there's just so much freaking milk there that you did not let go. And it is so painful. It happened to me once. Like, I didn't get to the full, I had pre-mastitis. Like, I caught it early enough before it turned into a full-blown infection. But it's painful because like I said, your breast becomes gigantic. It's overfilled with milk. It's clogged. And it's tough. Like, your skin becomes tough from how stretched out and like full it is. And it turns red, like your breast turns red. Because it's about to be an infection and you're going to get a fever and all of that. And the only real cure for it is to get that milk out. And it's the most painful thing ever to do. One way to help with that is to use like heating pads to try to loosen the milk up. Massaging helps. And there are YouTube videos. You can like literally YouTube mastitis massage to see what you got to do. But I'm giving you guys the heads up in case you know that's in your future, or somebody you know, you can support them and tell them what to do. Yeah, that's mastitis. Then there's also thrush. So thrush happens. So thrush is an infection that can happen. And what's the worst about thrush is it affects both you and baby. So thrush is like is it a bacterial? I think, no, it's a yeast infection, I think. Hold on, let me Google this because I can't remember exactly. Thrush. It's a yeast infection. So it's a yeast infection that grows in the baby's mouth. Usually because, you know, after they drank breast milk, maybe they didn't swallow it fully. They didn't, you know, they didn't clear their mouth fully. And then maybe they slept with their mouth a little bit open. And so that bacteria and the yeast just builds, and then they get the infection, and then they come to breastfeed on mom. And now mom's breast has the infection. And when you've got thrush on your breast and thrush in the baby cannot eat from you anymore. It's just a mess. Yeah, it's just a complete mess. I'm not quite sure what you could possibly do to prevent that. I think one thing you do is to just simply wipe the mouth when the kid is done breastfeeding to try to eliminate any buildup around the area, or maybe even like take a washcloth with some water and just kind of wash it a bit. You can't give a baby water to drink, so you don't want to like try to flush out their mouth with water. But you could just like gently wipe away. But that's just some of the beautiful hardships that come with the first months of life. And like I said, mom is like sleep deprived, hungry, not supported, doesn't have a support network. The hospitals kick you out. Like literally, some hospitals kick you out 24 hours after giving birth. At most, the most I've ever seen, if there's no complications, if your child is not in the NICU, if there's no emergencies, the top time that they'll let you stay at the hospital is 48 hours. And that's all you get. And then they kick you out and they're like, good luck. You get to go home. And then we expect moms to go back to work like 3 weeks later. Like, what? It's like, oh, you can't walk because your feet are swollen. Oh, you're recovering from like stitches down below. Oh, you're sleep deprived and hungry. You're suffering with breastfeeding. You have a baby who wakes up every 2 hours. Sounds like you need to go back to work. It's like the bizarre form of women torture I've ever seen in my life. We are one, if not maybe the only culture in the planet or on the planet that does that to our women. Most other cultures, even in the so-called third world societies, they take way better care of their pregnant women. Typically, you're gonna need a minimum of 40 days to get to an okay, livable place. Beryl, what's up?
I also heard that in Korea, they don't let they let the women choose if they either want to work or they want to get pregnant because they don't want to give the women what's it called day off or maternity leave. Like, why do I have to pay you if you're not gonna work? They always let the woman choose between do you want to work or you want to get pregnant, and I feel like that's kind of stupid because it's her body. Why do you care?
It's like, what is this? Yeah, I can't speak for what they do over there. I have no idea. But that's terrible. It's almost as bad as what we do here, honestly, because we expect you to be a full mother and a full-time worker. Like, what? Right? And if you can't be a full-time worker because you choose to be a full-time mother, well, then your partner better work their ass off to be able to support you because they're not going to get any time off. There's no paternity leave. Like, only in special circumstances, if you're lucky enough, can you get paternity leave, but let alone maternity leave, right? And it's not fair on the fathers either. I mean, they need a chance to bond with their child. They need a chance to get to know them, to learn to love them. They need a chance to be a family, to take that time, to take that break, to be together. But they just, a lot of times they don't get that chance. And then that's more emotional responsibility that falls on the woman's lap. And again, it's no wonder that women are stressed. They're in a terrible, terrible state. The most stressed out people on earth are mothers. And this is a statistical truth. This is just the truth. And that knows no socioeconomic, even rich women, they definitely have it way better than poor women. But even a rich mother is way stressed, right? So that's what I mean by it doesn't discriminate socioeconomically. Like, all women on the stress front, not created equal, but they do. All women will have stress as a mother. Even the ones who are bougie enough to have nannies to be like, yes, take away my child. They will feel stressed too. So what are some of your questions or curiosities about this 4th trimester period and what the mother goes through in that time? Or just any thoughts that you want to share? I'm also trying to remember if I said everything. When can the baby drink water? I want to say around 6 months. Let me check on that. I don't pretend like I have all the information memorized. But I think it's 6 months. Yep, it is 6 months. The reason for that is because that is when the immune system has fully formed. So babies are not born with a fully functioning immune system, by the way. They have to create the immune system after birth. By 6 months, their immune system is formed. So that's a great question. The other part of that, by the way, is that their tummies are so small in the beginning. So it's not like giving them water is going to endanger them to die or something like that. It's that their tummies are also so tiny that if you give them water, you will make them feel full, and then they're not going to get any nutritional value out of that water. So that's another reason why you don't give babies water early on. Great question, though. Boop, 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 boop. And like I said, next week, we're gonna start with infancy. I'll tell you some of the cool parts of like the first year of life is just so freaking cool. Like so much happens in the first year of life. Actually, the first 4 years of life are like the blueprint for the rest of your life. So if you want to be a lazy parent, don't be lazy for the first 4 years. That's where you got to pay the most attention. After that, you can ease up a little bit if you want. I have a 7-month-old at my daycare, and I have never seen a baby eat. Like some babies are hungry, man. They're like, let me eat. I want to eat. Some babies have an appetite. It's really amazing. And some babies don't. Some babies are picky. That's the beginning of personality. But we'll talk about that next week.
I have a question.
Yeah.
So for some babies, like for my aunt's kids, like two of her kids, they didn't like to drink from the bottle. They only like to drink from the breasts.
Yeah.
Why is that?
Because it feels foreign. Babies are very particular, right? They're like, this doesn't feel like mom. Therefore, I cannot accept it. So the recommendation there is it's expensive, but you gotta have to play around with it. You're gonna have to try different nipple types, nipple sizes, bottle types. Some babies don't like, for instance, glass bottles might be, the best thing out there, like the most hygienic and the most, like safe. But some babies might not like the feel of glass because people like they're humans, right? They have preferences. My kid, for instance, she didn't like glass bottles. Eventually I found a bottle, it's like silicone, but it feels like a breast. So she liked that because it felt comfortable to her. It didn't feel like a foreign thing. And the nipple shape was similar to like a normal nipple. So she was able to accept that bottle. So that could be what's going on. You just haven't played around enough with different bottle types and different nipple types.
And it's really funny. It's really funny because even though like when the baby's like really like starving, really, really hungry, they still won't take the bottle. Like they rather have the breast, but like it's starving.
Yeah.
It still insists.
No.
They don't give up.
For a baby, starving does not matter. Comfort is king. And we're going to revisit this idea next week. A baby needs comfort, love, security. It does not, obviously it needs food to survive, but I'm saying this like their cognition, like their logic, they can't logic survival, right? They're like, I will die on this hill, right? Like I will starve. I need comfort. Comfort wins always.
I have a question.
Yep.
Is it true that the babies can feel like what you feel? Like, let's say you're going through it and you feel like kind of mad or kind of sad, and the baby starts to cry, and you're like, why are you crying? Are you crying because I'm sad? Like, I don't understand how they know that you're sad. Like, how do you know I'm sad? You're not in my body no more.
Yeah, they just know. It is true. They know. They're very much in tune. I used to even like, and this might be a little TMI. I'm sorry, guys, but it's for the sake of knowledge. Okay. So even when I would be PMSing and I'm on my period and I'm agitated, I noticed that my daughter would get agitated too. It's like she was on a period too. And at first I didn't like see the pattern, right? I'm like, why is she crazy? And why is it just this week? Like, why does she's a perfect angel all the other time, and then during like 1 week a month she's crazy. And then I said it out loud one time. I'm like, wait a minute, 1 week a month she's crazy. I'm like, oh my gosh, she's in sync with me. That's why. So yeah, it's pretty nuts how they do feel everything. There have been studies even done on children who are blind. And so, because some theories are, okay, maybe they're reading it from your face, like your facial expression. But when they even study blind children, even blind children who don't have that visual cue can feel what people are feeling. It's just amazing, remarkable. Francisca.
I was thinking about